Hello, I'm Helena Gómez-Martínez, and I'm going to talk about novel computational strategies for the identification of a microRNA signature for diagnosis and prognosis in melanoma. But first, what is melanoma? Well, the melanoma is one of the most aggressive skin cancer with progressive increasing incidence in the last years. In addition, the late onset of symptoms together with difficulty of an early detection and the need for an effective treatment, have an impact in the high lethality of the disease. However, although clinical and epidemiological parameters show a differential pattern by sex in diagnosis and prognosis of the disease, there is a lack of knowledge regarding efficient biomarkers that favor the early detection and prediction of the evolution of the disease in patients. Taking into account all this information, the main objective of this work was a computational approach integrating all the information to improve the understanding of development of melanoma and the prediction of the patient diagnosis and prognosis. The bioinformatics strategies can be divided in two parts. The first ones began with a systematic review according to PRISMA statements. Then, only a set of studies were selected according to a previous criteria. After data download, an exploratory analysis was carried out in order to see the data distribution, and then the data was normalized. In a second part, an individual analysis was performed in order to define the different groups of contrast, and finally a meta-analysis by groups was performed. Then, the patient information was incorporated. The results reveal a significant biomarkers in diagnosis and a prognosis scenario. In the figure number 1, we can say that only 7 studies were selected after the systematic review. In the figure number 2, we can see some forest plot of some of the differentially expressed microRNA. In total, we identified 15 differentially expressed microRNA between melanoma and nevus tissue in a diagnostic setting of the disease, and 32 in a prognosis setting. As a conclusion of this work, we can say that the findings generated in this study have contributed to a better understanding of molecular mechanisms and the developmental process in melanoma, giving the possibility of developing novel resources for its detection and treatment in a precision medicine frame. Thank you very much for your attention.